Why do I have tinnitus? Understanding the ringing. Tinnitus is that ringing or buzzing sound you might hear in your ears, even when there's no outside noise. It can be puzzling and sometimes frustrating. So, what causes it? The most common reason is damage to the tiny hair cells in the inner ear. These hair cells are responsible for sending sound signals to the brain. When they get damaged, which can happen due to aging, loud noises, infections, or other factors, the brain receives fewer sound signals. To compensate for this, the brain might create its own sounds, leading to the perception of tinnitus. This phenomenon occurs because the brain's auditory pathways are trying to fill in the gaps where sound information is missing. As a result, you might hear ringing, buzzing, or other phantom noises. Tinnitus is often linked to sensorineural hearing loss, which affects those delicate hair cells and the auditory nerve fibers. Research indicates that tinnitus often occurs at the same frequencies where hearing loss is most significant. This suggests that when certain areas of the cochlea are damaged, the brain responds by generating tinnitus. While hearing loss is the primary cause, tinnitus can also be associated with other health conditions. For example, Meniere's disease and vestibular disorders can lead to tinnitus. Sometimes, these conditions directly cause tinnitus, while in other cases, they may share common underlying causes. Behavioral health issues can also play a role, affecting how we perceive and cope with tinnitus. It's important to clarify that tinnitus itself does not cause hearing loss. However, having tinnitus can make it harder to hear external sounds, which can complicate conversations or make it difficult to focus on environmental noises. When it comes to managing tinnitus, addressing any underlying hearing loss is crucial. Hearing aids or sound therapy can help restore auditory input, which may reduce the brain's need to create those phantom sounds. However, tinnitus is complex, and not everyone with hearing loss experiences it. This indicates that specific types of inner ear damage or changes in the central nervous system might influence whether someone develops tinnitus. In summary, tinnitus mainly arises from damage to the inner ear's hair cells, leading to reduced sound input to the brain. This prompts the brain to generate the perception of ringing or buzzing. Understanding this connection helps explain why tinnitus and hearing loss often go hand in hand, and why managing hearing loss is key to treating tinnitus. If you are experiencing tinnitus, it is always a good idea to consult with a healthcare professional for personalized advice and management options.